right. Welcome everyone. So we're kicking off now the public hearing for the Community Development Block Grant for the City of Greenfield. There's a couple of agenda items to talk about today. The main purpose of these hearings is to gather public input on proposed projects that CDBG funding is going to go towards. There's the actual public hearing now, but the announcement includes information about submitting written comments, so we'll also accept those, which is relevant given particularly low turnout. But that's fine. This is just the opportunity for folks to hear about new things that we're going to add to the grant. So the grant that we're talking about today is the Community Development Block Grant from fiscal year 22-23, which was awarded last year. And when it was awarded, we had an administrative budget line item for an administrative project that we were then told was we couldn't use CDBG funding for. So we had $20,000 in that admin budget that needed to be reallocated. 12,000 of those dollars went towards an existing project in this grant, which is the 60 Wells Street individual shelter reconstruction. So that just expanded their budget, which was appropriate given that their construction costs have kind of skyrocketed from their initial expectations. And then the remaining funding from that chunk, we're proposing to allocate to the Children's Advocacy Center in order to expand their parking because you are seeing an increase in clients or patients because of the outpatient services that you're starting to offer. For Community Development Block Grant, there has to be what's known as a national objective for each project. Typically, that is providing benefit to lower moderate income people, and it's understood in the block grant policy that children who are victims of abuse are assumed to be low and moderate income without any kind of verification required. So this is on its face a completely qualifying project. So with that in mind, we can accept comment in general, but I think it would also be kind of cool to hear from the director of the CAC, just for a little more information for the record about why you're seeing more clients at your space and why this is a public good that we should participate in.
Great. Thank you, Anna. So just for the record, my name is Dr. Jeff Trant. I'm the Executive Director of the Children's Advocacy Center of Franklin County in the North Quabbin. We are a nationally accredited children's advocacy center, which means several things. So we are the place where children come when they've made a disclosure that they've been a victim of sexual abuse, serious physical abuse, and sexual exploitation. We're a private nonprofit organization that's universally accessible to every child that lives in Franklin County in the North Quabbin region. Specifically, that means the town of Athol. We follow the prosecutorial jurisdiction of the Northwestern District Attorney's Office. So even though we are a nonprofit organization, really, we are a partner with the District Attorney's Office in ensuring that first and foremost, whenever a child makes a disclosure, there is an integrated multidisciplinary team response, where first and foremost, in the olden days of the child welfare system, when a child made a disclosure, they would be interviewed again and again and again. And we would do that because both our criminal justice and our child welfare systems are very bifurcated, and you have a civil and a criminal response. And the net effect was that a child would have to tell their story again and again. And typically this happened in these very bureaucratic office buildings, in police stations. And consequently, the child felt like they did something wrong. And ultimately, we weren't able to successfully prosecute cases because there would be prior inconsistent statements, because the way that I ask a question as a behavioral health practitioner is different than the way a detective may ask a question. So the whole concept of a child advocacy center is that you have a child-friendly environment where a child and their non-offending parent can come in and be in both a physically and a psychologically safe place, to be able to receive a non-directive interview, and that rather than the child going to all these other agencies, all the agencies come to the child, and that they're able to just be interviewed a single time, and that's done by someone who is trained and uses a scientific and legally valid interview protocol. So the goal is to reduce the amount of trauma that children have. The other kind of part to what we do is we provide very specialized medical and mental health services. Just because we interview a child doesn't help them heal. That helps with the prosecution. It may help with some of the justice and the accountability, but ultimately we want to help children heal. And that's why having an organization like ours in Greenfield, I think is very unique. And I will tell you that both Franklin County and Hampshire County have two of the most unique CACs in Massachusetts. The others are attached to district attorney's offices, and they're also based in hospitals. We're an independent organization. And so that means we're able to work with families on an ongoing basis, and we're not constrained by some of the limitations of having to turn over every piece of information we receive through the discovery process. And so we work very closely with the Department of Public Health. We have a pediatric sexual assault nurse examiner who's a mid-level practitioner, an NP who's on staff, and we actually provide forensic medical examinations out of our facility on Wisdom Way. And that's actually part of the statewide DPH system. And so I say that to say that a child who needs to receive a follow-up appointment, not like an urgent critical appointment where they need to be in an emergency room immediately, but for things like STI testing or other kind of more wellness-based activities, they receive the same quality of care on 56 Wisdom Way as they would if they were at Mass General. And quite honestly, it's the same staff that are working with them, and that there's actually a child abuse pediatrician from both Boston Children's and Mass General who are part of the system. So if there's ever an indicated finding, they're doing a review with our practitioner in real time through telehealth services. Also, kind of the biggest area of growth for kind of the Children's Advocacy Center has been in around our mental health services. And that I don't think you have to look too far to know that we are in the midst of a mental health crisis. And that when you look at kind of the statewide average over the course of the past 18 months, the average amount of time a child under the age of 18 spends on a wait list to receive outpatient services is about 6 months. And that's a horrific number when a family and an individual is having a crisis. However, 6 months is actually a really good number compared to what we experience in rural communities. That number can be anywhere from 12 to 14 months. And that's not to see someone who specializes in this type of kind of evidence-based intervention. That's oftentimes to see an entry-level practitioner who doesn't have this level of training. So over the course of the past 2 to 3 years, the Children's Advocacy Center has really expanded our clinical bandwidth. And so we do about 30 ambulatory visits at our center a week. And that's part of what's driving, kind of our need for capacity and basic infrastructure around things like parking. When we built our facility, we often talk about this. The whole concept was children come to us to receive an interview and they leave. We were thinking that we'd be open 4 days a week for 20 hours a week. We're there 6 to 7 days a week. We're there 12 to 14 hours a day. We've seen more than 900 children since we opened our doors in early 2015. And so our ability to just provide more services is absolutely critical to addressing just access issues. Even though we serve all of Franklin County and the community of Athol, we work very closely with the Department of Children and Families Greenfield area office. And that when children are taken into custody, truly they become residents, kind of Greenfield, irrespective of where they are by virtue of kind of where that DCF office is located. And so I would tell you that statistically, we serve, kind of a disproportionately high number of children who come from Greenfield as well. So for us, we are really looking at, kind of how do we help build infrastructure so we can provide sustainable services to the most vulnerable victims among us, which are our children who are victims of crime. So we're just, on behalf of the CAC, I just want to express my thanks and appreciation to the city of Greenfield for your enduring support and for your support around these very, kind of specific projects. But ultimately, these are absolutely critical for us to be able to serve children and families. It is not uncommon where we will have, a stacked parking lot. And that one of the things that happens is that oftentimes our providers, our staff, and our partners from law enforcement or other offices, they're always the first ones that are there. And that what ultimately happens is that the families are the last ones to show up, and that, we don't have parking for them. And so they park on lawns. They sometimes turn around and leave. And so for us, this is a critical infrastructure issue to make sure that we can provide access, and that most importantly, we make people feel welcome when they're unfortunately going through one of the most traumatizing and horrific things that has ever happened to their family. So thank you.
That's really helpful. Thank you so much. Yeah. Would anybody else like to add comments or questions for Dr. Trant?
Thank you. Well, we feel very privileged to do this work, and we feel very privileged to be able to do it in this community, because Franklin County, in Greenfield in particular, is such a unique community with social capital that doesn't exist in other areas in the Commonwealth. And one of the reasons why we exist is because, unfortunately, the residents of our great community understand the need for us to be here, and have supported us, since day one. So it's a privilege to be able to do this work.
So I suppose just to give folks a sense of the timeline, this now becomes an amendment to the existing grant, which will be submitted to the state in the next couple of weeks. And then I guess I can't give you a concrete sense of how long the amendment process will take on their side, but we'll probably know for sure, honestly, in just a couple of weeks. And then, as I said, that funding is already in the grant object. So then we would essentially draw up a contract with the CAC and go from there. But
Great.
yeah, that's where we're at. Thank you, guys.
Well, thank you.
So I suppose I will briefly take us, while I have a captive audience, through the remaining new projects for this grant. So as I said, this is funding that's coming from an administrative line item that is no longer going to be used. In that same grant, when we applied for it, there was a $187,000 allocation for design and engineering of Port Square to turn it into a permanent pedestrian plaza. That project has been canceled. And so all of those funds are being reallocated. We have two projects that we're proposing to reallocate them to. The first is a slum and blight inventory study, and the second is what feels like a tiny little piece of sidewalk repair that has a price tag of about $101,000. So I'm going to show my screen really briefly, just
Yeah, you have to click share to where it says sharing locally. Yep.
there you go. Share meeting.
Yep, now it'll be in the recording.
Cool. Okay. So the piece of sidewalk we're talking about is right here on Hope Street. So if you're familiar with Greenfield and you're coming from the south, you head up Washington Street and take a right onto Russell, and you go under a bridge where the railroad tracks are. And right up on Hope Street, so where it intersects, there is a dilapidated sidewalk that is closed off to the public. So this is kind of what it looks like. The reason is that when the other sidewalks on Hope Street were reconstructed, that kind of became the accessible pathway going down and back up, because the structure on up on the Hope Street side was not sound. And it's kind of been sitting on the list of city projects that definitely needs to be addressed, but no one was sure where the funding was going to come from until a couple of city councilors brought it forward to DPW. So this is a project we're proposing with the state right now. As I was saying about national objective, this is one where we have to show that the neighborhood is predominantly low or moderate income. So we have an income survey out to that neighborhood right now. If you know folks who live around there, please encourage them to reply. So that's one that we probably won't know about for another month or two, whether we'll be able to proceed. And then the other topic that, or the other project that we plan on funding with this allocation is a study to designate an area of the city as a slum and blight target area. So I'll try to explain this succinctly, but for community development block grant purposes, if you have a designated slum and blight district, and that has to essentially be proposed by the municipality and then approved by the state. It becomes much, much, much more straightforward to get CDBG funding for infrastructure improvements. So this Hope Street sidewalk, that seems like an obvious project, it's a mess, it needs to be replaced, it's not safe. We wouldn't have to go through the whole process of income surveying the neighborhood. We could say this is a blighted area and this improvement will directly address the causes of those blight. So to do that, we basically need to spend some money upfront to get a professional survey of the area completed. And then once we submit that to the state, we can designate an area for a period of 10 years. So the city, since 2016, has had the central commercial district of downtown designated as a slum and blight area. So that designation will be up in 2026, and we're prepared to propose a different area for the next round. So currently, our office and the mayor's office and planning have been planning which area we think this is appropriate for, and we're looking essentially at the corridor coming into Greenfield from the south, Deerfield Street, Washington Street, and potentially Hope Street. Like I said, this will be a matter of surveying the area with a planning firm, and we have to show that at least 25% of the properties in the given area experience this physical deterioration, abandonment, chronic high occupancy, turnover rates, declines in property values, or known or suspected environmental contamination. 25% isn't a huge number, but it means that it wouldn't be worth doing this in an area where we weren't pretty sure we're going to meet that cutoff, because doing such a study is kind of spendy. So that's what we're proposing. We're going to look at that sort of entryway corridor to the city. And the timeline for that is much more spread out. Probably we would get that kicked off sometime later this year or sometime next year. Any comments or questions about such? Yes,
I appreciate that the word decadent is in there.
me too.
I'm not quite sure what it means in this context.
Oh, I will tell you.
Oh, good.
Oh, wait, no, not here.
It sounds more exciting than it should be.
A decadent area. This is from Mass General Law, which defines it. I won't read it out loud to you, but the definitions in the law, I guess I'd be interested to know when these were constructed, but it's essentially any area that is quote unquote detrimental to safety, health, morals, welfare, or the sound economic growth of a community, which is interesting in and of itself as well, but it can be pretty subjective.
Yeah.
Lastly, just some existing projects that in the open grants that we have. The 2021 grant is just about done. There's just one more project that we're finishing up this spring, which is some design and engineering for improving the ADA accessibility of this building. And then the grant in which the CAC project will fall is this 22-23 grant, which was a COVID era double whammy 2-year grant. And that's just getting kicked off. So as you can see, some of these projects haven't even started, and the period of performance is through at least next June, likely longer. So there's plenty. Any last comments or questions?
I live on Hope Street. I'm excited that sidewalk might get fixed.
Thank you. Good. All right, well then I'll end the public hearing there. Thank you all so much for joining us. Like I said, we accept comments as part of the hearing for the next at least week or so. So if you think that folks want to write in and have their statement on the record, that's fine. But I'll keep you posted.
Great.
Thank you.
Thank you so much.